Okay. May, how do you feel about opening us up?
I am ready. Good afternoon. My name is May Shalal, and I am the president of the board for Bright Paths. On behalf of the board of directors, the staff, and our clients, I'd like to welcome you to this town hall and thank you for your support, past, present, and future. The board and staff are very eager to share our view of what diversity, equity, and inclusion mean to us. The events of the past year in particular have taught us that this is a conversation that we all need to be a part of. We all need to take part in. We're really happy that you decided to spend some time having this conversation with us. So I will, without further delay, pass it over to Shannon, who will guide us through the rest of this program.
Thank you so much. Can everyone see the PowerPoint now?
We're good.
Yes.
Wonderful. Okay. So just going to do a quick flyover. You'll hear my voice again throughout the next hour, but we're just going to focus on a few conversations. This is not by any means an exhaustive conversation on equity and inclusion. This is a teaser at best, a refresher for some, but it's sort of a pulling back of the curtain on what we're doing here at Bright Paths, what we're doing individually, and what we hope to do in the future. In general, these town halls are designed to be just that. It's sort of pulling back of the curtain. And, you know, this past year, we have all experienced so much and so many things have come at us. But one of the things that I'm really excited about is this phrase that I'm going to thank Lynn Latimer, who forwarded this to me this morning. And it really does a really good job of encapsulating what it is these town halls are about, what our work is about now, and what we hope that you understand our work together will be. And that is going from just doing good in our community, which we think that we are, and turning internally to understand why we do this work, how it connects to the larger global conversation around equity and fixing systemic inequities that we have all lived under, but haven't really had a time to pause and talk about really and come on one accord. So really this past year for us as an organization has been about not just changing ourselves, but understanding ourselves, each other, and how we can approach these conversations in a more equitable fashion and together. That's really the key. What we hope that you'll learn is actually more about what we hope that you will, how you will be. And I will share very quickly before I turn it over to Lisa for an official introduction, the sort of B's that I would want of you all. Number one, be courageous. Some of these things that we're talking about, some of them are new for us, but don't worry about that. It's new for everyone. So we're moving in lockstep progression. So don't worry about things not really being sinking in, or if you're not really versed on a topic, or if you want to ask a question but feel maybe it's not appropriate. This is the space that we're trying to create so that we all feel comfortable having these conversations. So be courageous, be brave, be respectful. And that's just sort of self-explanatory. I would say be curious, right? We want to make sure you're asking questions and providing opportunities for evocative and forward movement kind of conversations. And then be present. So any distractions that are around you, try to minimize those things. Have a pen and paper if you have that available to jot down questions in between so that we can have some inquisitive revelations later on. Or maybe you want to jot something down for a conversation later, but I would say be present and you'll reap the rewards. So with that having been said, I'll come back with a couple of other to-dos before we jump into it, but I want to go ahead and hand it over to Lisa, who has a few words to say. Lisa, do you want the PowerPoint up or do you want to speak directly?
It doesn't matter.
Okay. We'll leave room here for a little bit.
Well, I just wanted to welcome, I'm sorry?
Go ahead.
Okay. All right. Well, welcome everybody. We're so glad that you're making time to be with us today. You'll notice that people have their name and Bright Paths beside their name, and either they're board members or they are staff members. So as Shannon was talking about, there's an opportunity for questions and answers towards the end. And so you can ask some staff directly. So just keep that in mind. So, as you can imagine, during the pandemic, we've been trying to be creative with ways to engage with you. our supporters, whom we value so much. One-on-one meetings and gatherings are not the safest yet, and we hope to be in person in the fall, so stay tuned. In the meantime, the virtual town hall format provides an opportunity to inform and answer questions. So it's been a tough year for everyone, and BrightPaths adapted to virtual programming in early March without missing a beat. As the year drew on, an additional layer of stress was added with the protests for equity across the country. Our clients, staff, board felt that stress, as I'm sure that you did. The concept of DEI, or diversity, equity, and inclusion, is not new to BrightPaths or to our community. For the last 5 years or so, we've been involved in community discussions on this topic and seeking ways to institutionalize equity within our operations and programming. It's not easy, and we are certainly on a fumbling kind of journey. But the more we learn, the more we want to be intentional about our path and make changes along the way. We are bringing this concept into our discussion in hopes that you want to join us on this journey. Later in the program, Dawn Hyman from Fairfax County will be talking about the One Fairfax initiative. And Christina Garris, our programs director, will be talking about how over time, we used an equity lens to make programmatic changes to our stability programs. Our board of directors is on this journey as well. Every year, the board and staff have a joint one-day retreat where we establish annual goals that roll up into our strategic plan. And this year, the board created a DEI working group and dedicated funding to ensure that we had capacity to handle this journey. Last year, I created a diversity committee, which developed a value statement that was recently presented to the board for discussion and imminent adoption. And additionally, per the committee's recommendation, the entire staff started off the year reading the book, How to Be an Anti-Racist, and watched the documentary movie 13th, following each learning experience with an all-staff discussion. And just creating that space to talk about it was a healthy step on the journey. And it's not an easy thing to do. We're all still learning. And again, we are really glad that you're joining us on this important journey. So I hope that you enjoy the rest of the program today. And Shannon, I turn it over to you.
Thank you so much. I'm going to go ahead and put the slide back up. And at this moment, I want to underscore something about our organization and the strength of our organization that I've recognized in the year I've been here, and that's just the idea of strategic partnerships. Dawn Hyman, who I've only met recently, but who has been working with BrightPaths for a number of years, I can tell you from the recent conversations that we've had, she has just been it's very evident that she's invested in this conversation, not only on behalf of the One Fairfax initiative, but it seems to be her life's work, and certainly her reading list, which she has shared with me, indicate that this is very meaningful to her. So I'm happy that she's agreed to share some of her insights with us today. And with that, I'll have her give a little bit more of her introduction, but thank you, Dawn, for being with us, and I give it to you.
Thank you so much, Shannon, and thank you, Lisa, and thank you to the staff and board and donors for having me, to have this conversation, a very important conversation. I just want to echo one thing that Lisa said earlier. This work is a journey. It's not a destination. And this work requires lots of learning, lots of conversations, and more importantly, lots of discomfort. And so we have to start learning how to be comfortable with being uncomfortable in order to address these institutional and structural inequities that we are finding across all of our systems. So what I'd like to do now is just to provide you with some foundational context about One Fairfax, as well as some equity concepts just to help the conversation and help to facilitate what we'll be talking about later throughout this town hall. So first, One Fairfax, as I'm sure many of you have heard, is a racial and social equity resolution and policy. And it commits the county and the schools to intentionally consider equity when making policies, planning, and delivering programs and services. It also involves community and stakeholder engagement, training and organizational capacity building, as well as data analysis, collective planning and action, and shared accountability mechanisms. One Fairfax poses two important core questions. First, who benefits and who is burdened by past and current actions? And how can burdens be mitigated and benefits more broadly shared? And so now I'd like to do is just kind of talk through some of the equity concepts. And as Shannon and Lisa alluded to earlier, I know that BrightPaths has been on this journey for quite some time doing DEI work. So what I'd like to do is just take an opportunity to quickly go over definitions of what that is, recognizing that One Fairfax is focusing on equity. We do recognize that diversity and inclusion are important elements on this continuum. Our focus with One Fairfax, however, is really about outcomes. So what is diversity? It can be referred to as people and perspectives. It refers to a wide array of differences among people and their perspectives on the world. It is an important organizational goal in its own right, but a diverse workplace is not necessarily an equitable workplace. Inclusion is reflected in organizational culture where diverse peoples can raise their perspectives authentically, and where those voices matter and impact decisions. Promising a broader view of the world and a more democratic process of decision-making, inclusion is an important organizational process goal, but it does not automatically guarantee equity in an organization's results. And then lastly, equity. Equity refers to results where advantage and disadvantage are not distributed on the basis of race and ethnicity. Strategies that produce equity must be targeted to address the varying barriers experienced by different racial and ethnic groups and communities. Equity requires informed policies and practices intentionally designed to promote opportunity and rectify disparities, as well as informed people positioned to implement them effectively. So when we talk about diversity, it's who's around the table. Inclusion is how do the people feel? How do the people around the table feel? And then equity, what decisions are being made around that table? Is there, I believe there's a slide that goes before this one.
May have been. This is what we have, Dawn. Can we describe the slide?
It is a, it has a graphic of folks looking at a baseball game.
Can't find that. It's not in this deck, but we can find it in one moment if we need that. You start talking, I'll pull that up, okay?
Yeah. So one of the things that I wanted to address is the difference between equity and equality. And oftentimes these terms are used interchangeably, but unfortunately, these two terms don't have the same meaning nor the same outcome. And so we really should not be using them interchangeably. When we talk about equality, we are talking about sameness. So basically everybody gets the same thing, right? When we are talking about equity, there we go, it's that one. When we're talking about equity, we're talking about fairness, recognizing that people's situations and needs between each other are going to be different. And oftentimes the goal that we're trying to achieve may be the same, but the strategies that we use to achieve that goal are going to be different because they recognize that those situations and needs are different. And so here, when you see in this graphic on the left, this represents equality, where you have three individuals trying to see the game, which is the goal. And each one of them is getting the same number of boxes. But we also see that unfortunately, one of those individuals still can't see the game, even though he has the same number of boxes as everyone else. On the right side, here's where we are looking at equity, where everyone is getting whatever they need in order, again, to see the game. Now, One Fairfax, we tend to stray away from this particular graphic because it perpetuates a scarcity narrative in that it looks like we're taking away something from one person in order to give to another. And that's really not the purpose of equity or what One Fairfax is about. And so if we look at this graphic, we see here that this reflects the systemic nature of racial inequities and injustices with a graded ground and the sloping fence, and the people relatively the same height. So in here, it's not the people's lack preventing them from participating in the soccer game. It is the unjust system and structure that's represented by the ground and the fence. And so true liberation would really mean there would be no fence at all. And then lastly, what do we mean by racial equity? So closing the gap so that race does not predict one's success while also improving outcomes for all. And in order to do that, we have to do two things. One, we have to target strategies to focus improvements for those worse off. And two, move beyond services and focus on changing policies, institutions, and structures. It also means that working within our institutions to ensure that race no longer plays a predictive role in determining how well we do in American society. We hear a lot about racial inequities, but we think it is really important to think about what we aspire to, racial equity, where we would eliminate racial inequities and increase success for everyone. Our goal isn't just to close the gaps, since we don't want to just make this equally bad for everyone. Achieving racial equity requires us to have to be able to target strategies, again, to focus improvements for those worst off and move beyond services and focus on changing policies, institutions, and structures. Oftentimes, when people are working on closing the gaps, they think in terms of treating symptoms and not the causes. And as a result, end up talking about programs and services. While programs and services are critically important, they will never be sufficient to achieve racial equity. Through One Fairfax, we are challenging the belief and narrative that people of color and low-income people or low-wealth building communities are responsible for their disadvantage, or that disadvantage is based solely on the actions of bigoted people. Through many overtly discriminatory acts are now illegal, policies applied in previous generations still linger. Who could own a home or who could own a business, who could live there, and who has wealth to pass on? Exclusion from opportunity, whether intentional or not, has long-term consequences. One Fairfax shifts us to an expanded view of inequity and its bases and structural barriers to opportunity. Inequities must be challenged and dismantled through the collective action of government and community. Across all departments and functions, we have a shared responsibility to unlock the potential of every resident. I appreciate your interest in learning more about One Fairfax, and I'm happy to take questions once we get to the discussion portion.
Thank you so much, Dawn. And we'll go ahead and take just a second or two now as I switch PowerPoints, because we have such a resource. And Dawn, and again, this is an intro to an intro, if you will, of a conversation. But if there are any questions that we can entertain for the couple of minutes now, specific to the few slides and conversation that Dawn just presented, we'll go ahead and get those. Dorothy, did we have any in the chat?
Nothing is turned up yet, Shannon. I'm a little curious though myself. Fairfax County has some of the highest real estate costs anywhere. And it makes me wonder, what is One Fairfax doing to address inequities in housing?
That's a great question. So we are looking at a number of different things. One, again, as it relates to costs. Two, also recognizing that we need to change the narrative of what affordable means, recognizing that affordable means different things to different people. We also have to think about the types of housing that we offer. Again, recognizing that individuals and families' needs are different, and so that we need to think more intentionally about what types of housing that we're offering and that we are building. We're also thinking about opportunities for home ownership. So how do we expand that so that more people have opportunities to become homeowners, and also in that to generate wealth, because homeownership is equated to wealth building. So those are just some of the things that we've been looking at and thinking through more intentionally about how do we create a housing system that is equitable and just for all Fairfax County residents, recognizing that, again, people are coming from different socioeconomic backgrounds and have specific, needs.
Thanks.
You're welcome.
Time for one more if there's another burning question for Dawn before our second Q&A section.
Transportation. Oh, yes. So, yeah. And here's the other thing about systems, right? So, and I actually just gave a presentation about an hour or so ago to Leadership Fairfax, to one of their cohorts. And one of the things that we talked about was how all of these systems are interconnected. So it's when we look at solutions to our systems, we can't look at them in isolation, really have to think about them and how they're connected to other systems. So our transportation system is also connected to our food system, which is also connected to housing, which is also connected to education and childcare and health and so on and so forth. And so when we make decisions about these systems, we can't do it in isolation. We really have to think about what we're doing and how that's going to impact other systems. If I do something in the transportation system, that's ultimately going to have an impact on housing and food, childcare, education, and so on and so forth. So we really have to think collectively when we come up with solutions to address these institutional and structural inequities. We really have to think collectively about how that's going to impact those interconnecting systems. I know that right now I'm involved on an equity advisory group or committee with Department of Transportation. They have an active Fairfax transportation campaign where they're trying to expand ways for people to have access to trails and biking and things like that. And we're looking at the disparities within our current transportation plan in terms of as it relates to recreational and as it relates to recreational travel and paths, things like that, to see how we can start to develop more equitable ways that people can get out and have accessible recreational travel.
Thank you so much, Dawn, for those answers. And of course, stick around because I'm sure the other questions will percolate in the next few minutes. So we're really appreciative for those few words and thoughts and expect a few more. Go ahead and continue to put your questions in chat if you so desire. I'm going to go ahead and go back to our PowerPoint, and at this time, explain it. Today really was about making sure, pardon here, that we had two things, sort of a global understanding of where we stand in the conversation around race, equity, inclusion, diversity in our region. So that global sort of understanding and context and shared language, and then drilling down a little bit, going back to that Rumi quote about learning and changing ourselves, really taking an internal look and saying, how does equity make itself manifest in our programs, and how have we been doing that already? So one of the things that comes to mind, and Dawn just referenced it a moment ago, the idea of looking at individuals, right? Individual family units, individual citizens, and saying what is it that is your resource challenge? And for us, equity really is about making sure that we approach each client with a level of respect and dignity that acknowledges their unique situation. So to that end, I would invite a quick look at the growth of our programs over time, and then I'll pass it along to Chris Garris. We started years ago, 37 years ago, just attempting to focus on food and feeding the homeless. And then an evolution started happening. So the idea of preventing homelessness by making sure that people had dollars and resources for some of their basic needs, like food, so that they can stay in their homes and stay on the path to self-sufficiency. And of course, once you begin to look at holistically what a person or family needs, then you begin to acknowledge all that can be in terms of respecting that individual and their journey. And so I'll hand it over to Chris now to tell you a little bit more about how we've done that as an organization and how we plan to do that in the future. So Chris, all yours.
Okay, thank you, Shannon. So I am the programs director and I've been with Bright Paths for 14 years and I've seen a lot of development. And so I'm going to start with the food program. Bright Paths Food Assistance consists of several food programs that help families struggling to make ends meet. We provide one-time grocery gift cards to clients in a crisis that need immediate help. Clients working towards self-sufficiency with Bright Paths programs or a caseworker support stay on our food program for 6 to 9 months. In 2009, Bright Paths stopped to reconsider its food program model. At that time, it was collecting non-perishable food for its pantry. And that was also true of its weekend food program, for which support came from mainly the interfaith community. When surveying our clients, we heard that the food did not suit their needs. We already knew how hard it was to prepare meaningful food packings, even when trying to account for dietary restrictions. But cultural differences weren't really being considered either. And frankly, a lot of what was being donated was not healthy. We understood that each person deserved the common dignity of choosing what went into their body. So we decided to start soliciting monetary donations to purchase grocery gift cards to give our families the autonomy to make their own food choices. We were pleasantly surprised that our donor base quickly understood and supported the change to allow our clients the dignity of supplying their own needs. Bright Paths, our daily veggie farmers market program, provides vouchers to our clients so they can purchase fresh produce and protein products from participating vendors at area farmers market. We provide helpful options that our family can pick out for themselves. We provide healthy eating workshops and walk over to a market together to shop afterwards. It is an enriching experience to see families enjoying what the market has to offer. Our Food for Thought program partners with social workers and parent volunteers to enable them to send home food for students who may go without food over the weekend. We will talk more about this program during the third town hall in our series, Supports for Children. For now, we think it's an important example of how our focus on addressing the actual needs of families led us to see and begin to address deeper issues of inequality in our region. Because of the lack of affordable housing in Fairfax County, many of our neighbors are just a paycheck away from possible homelessness. We offer financial assistance for rent and utilities to our clients in times of crisis. In 2014, Bright Paths recognized a need for car repair funds. we started Reliable Rides, which helps fund major car repairs so that clients in crisis can continue to get to work to support their families. It is one of the few available car repair assistant programs in Fairfax County. Adapting during the pandemic, when the pandemic hit and everyone was stocking up their pantries, we acknowledged that would not be the case for many of our families. We offered all of our food clients to come pick up food and toiletry packing, which included a grocery gift card. One of our clients, a nursing assistant, was due to have a baby in a week. She was so grateful for the diapers, toilet paper, and cleaning supplies that you could no longer find in the stores. Once we had served all of our clients, we closed down the pantry and went to grocery gift card. After the economy tanked in 2008, we received stimulus funding, which allowed us to see how we could make a real impact on families by combining our food and financial assistance along with financial literacy education. We were inspired to create workforce program that started us on a path to directing our food and financial assistance to families who are working towards self-sufficiency. So you can see how a focus on stabilizing led to a focus on the resilience of families to withstand crisis or prevent them. Thanks.
Thank you so much, Chris, for that timeline and for a real understanding of how the evolution just sort of naturally happens when you begin to focus on the right thing, focus on the individual and see their situation. One of the things that I am excited about for the next couple of minutes is we have, so we went from a global understanding and context given to us by Dawn and an understanding of what it is that we do here at Bright Paths in terms of our approach to equity, what we're doing and hope to do. And it's important that we hear from a client as well. And this is an opportunity to understand the bridge between immediate needs and sort of long-term planning. And before we listen to the clip, I want to share sort of an academic perspective. And psychologists have a phrase they use called forced intention on the present moment, or selective intention. Selective intention is something that we use when we have the need to focus on preparing a PowerPoint presentation, for instance, and the ability to sort of put other things out of our minds. So it can be a positive thing. But when you don't have choice of what you're focusing on, it's a forced focus, selective attention on the present moment. What happens when you're forced to think about being hungry or not having money for rent? Everything else sort of falls away. So you're not worried about your health, or you're not making long-term plans. You're really at that base level of survival. What happens with clients and others who are in situations who find relief in a partnership with organizations like ours, who understand the whole person, the reset that happens after we take care of initial needs and then say, stay with us. We want to focus on your next steps as well, so that you can prevent crises in the future, if that is your path. And so listen for a moment to our next guest, who was a client who recorded a conversation, and listen for the change that happens in her voice when she understands getting help from Bright Paths allows her to begin to think about her next steps.
My name is Jacqueline Fuller. I have been working with Bright Paths since August 2020. Well, one of the concerns I had figuring out how I was going to maintain my income, to pay bills, things like that in my household, particularly because I was one of those people who did fortunately have savings, but just with the situation with the COVID pandemic, my funds were running out. And so one of the things so far that Bright Paths has been helpful with is the food assistance program that really helped out a lot in regards to making sure I have, groceries here at home too. And I'm also getting help through the mentorship program with the process of looking for work, particularly with that, making sure during my job search that the positions that I'm applying to were in line with the direction I wanted to move forward with in my career. Just being very mindful in these job searches and making sure that the positions and the compensation for working at these places were a good fit. Because my goal is to achieve economic self-sufficiency. So I don't want to be in a position where I'm working somewhere and it's another paycheck to paycheck situation. I think people should know is that everyone's situation is not a one size fits all.
Right.
I guess one of the concerns I tend to have with sometimes dealing with the local resources is that when I say local, I mean in the sense of government, local government resources, it's not a timely process. So it could put people in situations where you're still in limbo because you don't really know what's going on and you don't know how long it will take for those things to be able to receive them. And in addition to that, people like me who don't have a family, I don't have children, not married, it's also a challenge because there's a lot of limits to receiving things because you don't have dependents or you're not part of the family. So that can pose challenges, particularly being a professional when you're someone who's, have to still like paying student loan debts, things like that, trying to really, like I said, my goal is economic self-sufficiency. So have been focusing a lot on paying down my debts before COVID happened. So it's hard because it's like, if you want to move up in life in one area, you have to, take care of the other situations before moving forward. And situations like this can really, it puts it's like a halt or a pause where it can even ship you off track. And it's helpful when you have services like BrightPaths.
And we thank you, Jackie, for those words. So at this moment, again, thank you for listening to that. And as you heard Jackie mention, just the idea of being stuck or paused because she's forced to focus on the present moment, then is relieved when there's a partnership that says, we see that, we'll help with that, and then we'll help you take your next steps. And really, if I can put a quick plug in, our Brighter Possibilities campaign this month really is about that. Let's focus on getting folks stable, their feet grounded, and then help them to look up and at their next step. So thank you all for entertaining those few presentations. And we want to open it up now to hear your thoughts and feelings and questions. So go ahead, if you don't mind, getting yourself off video and showing your smiling faces. And let's hear if we have any questions for Dawn, Chris, Lisa, or anyone else on staff or on the call.
I wouldn't mind elaborating on the question about referrals. So we do receive referrals from other nonprofits, from CSP, Fairfax Coordinating Services. But for the financial and workforce development programs, you can self-refer. And once you're working with us, we will take a look at your situation through your mentor. And if you need to be on the food program for 6 or 9 months, that's when you're approached and are able to benefit from that program.
Thank you. I'm okay with awkward silences, folks. I want to maybe ask a staff member who's more familiar with stories, and Heather, you may have that story that you shared yesterday, but Chris mentioned that at the time of the pivot, really considering how donations of food weren't really aligning to needs. And we have a few stories about just how that looks and how that feels on the client side. Heather, do you mind?
Yeah, when we were discussing this the other day, it reminded me of a gentleman that came to us. This was not long after we started really trying to offer gift cards as much as possible for food deliveries and emergency food. And he had some kind of health issue where he couldn't process certain foods or certain ingredients in foods, and it was something that really showed up in canned goods and shelf-stable products that the food banks give out. And he was in really poor health. It was hard for him to work, and then it was hard for him to make money to buy the kinds of foods he needed. And he was being sent to food banks to get food, and the food was making him even sicker. And so they referred him to us, and when we gave him gift cards, it just changed his life. I mean, he was able to get healthy again on our food program and get back to work. And it just really, you know, like I said, that was new. We're still new to doing this, and we really just saw that impact there.
Thank you for that. And I mentioned yesterday when Heather shared that story to the internal team that one of the things that we may or may not recognize is, you know, I grew up where food is precious. It's part of your cultural tradition. It's a gift, right? It's one of those things where if you get a container, you return that container with food because that's an extension of, you know, your heart and your compassion. But, you know, I used to tell a story and told the story a few times that when I was growing up, we had troubles and times where we needed to seek help. I remember, you know, very clearly getting a can and a delivery of water chestnuts. And I remembered exactly where I was standing, exactly what my mother's face looked like when she opened that package and realized, like, what is it that I'm going to do with this? And I felt in that moment, this is 35 years ago, there's a visceral feeling of like, do they know who we are? And understanding that people, unless you just get it right, the possibility of giving someone the impression that they are less valued, that's a real risk, and a real risk that has consequences that most of us don't ever see and ever remember. So the idea of someone being in such dire straits in need of food that they would, you know, sort of forego their longer term health just to eat for today, and no one really asking that question, you know, that's something that stays with folks. So we're happy to have moved away from that and encouraging folks to understand why we do that, and how doing something different really is a step in the right direction of recognizing everyone's sort of equitable access to something as basic as food, right? Something we all need.
Hey, Shannon, Catherine wanted to hear a little something about workforce readiness and what Bright Paths does to encourage that.
Great question, Catherine.
Well, we have our Sally Myers, who's our Director of Workforce Development, and we have our ACT program, so for health cohort, and we have our Financial Empowerment Center. Maria Jose, our director, is here today. She could talk a little bit about how our clients, when they first come to the Financial Empowerment Center, they do talk with one of our staff, and workforce development is often one of the directions that we send them to talk with Sally and find out what their needs are. And they look at resumes, the jobs that are out in the area that might be a good fit for them. Maria Jose, do you want to say anything?
Yes, I just wanted to add that during the financial coaching sessions that we offer at the Financial Empowerment Center and with the classes that we offer in the community, workforce development is something that is coming over and over with the clients because of they are underemployed or they are unemployed, and they are trying all the time to find ways to improve their financial situation. But in order to do that, they need some help from us, from the community. One of the things that we were able to offer last year during the pandemic that was
pretty amazing was computer classes for our clients. Clients who maybe were trying to jump into another position or maybe having another chance, and with everything closed, we were able to offer computer classes. And they were very well attended. We were able to do at least 3 series of classes totally online. That was something that originally we were planning to do it in person, but we were able to do it online, and it was very well received. And again, we are working very hard with Sally, trying to find opportunities and connect our clients to improve their resume, to improve communication skills, how to actually present themselves. We have been doing different type of workshops since last year, and they have been very well received, I wanted to say.
I know Don, working with the county, recognizes the workforce development need, that all these jobs, hotel jobs, you know, they may not be coming back. And so one of the things we really do try to work with a client to figure out how they can take their skills and put them, you know, in a job that they can do right now. Don and I also have had the pleasure to be on networks. We're on Fairfax Food Council, the Food Provider Network, for years together. And I know, Don, you can speak on what we've seen, the change, not just our organization, but Food for Others, other organizations that now have choice pantries, so you can go in and shop. So we've really tried to spread the word about making sure we're looking at a client holistically and not just saying, here, this is what you need, this is what the donors want to give you, and that's that. Do you want to talk about that at all, Don?
Sure. So I will say for Bright Paths first, since this is Bright Paths, so I'm going to talk about Bright Paths first. But and I've told this story before to Shannon and to Chris. But one of the things, as Lisa actually alluded to again in the beginning of this presentation, is that Bright Paths has been doing this work for quite some time. And in my previous role with NCS, I was the staff liaison for our Food Providers Network. And I remember one of the meetings that we had where we were talking about, you know, how can we be more intentional with the work that we're doing around food. And I'll never forget, Chris was in this meeting, and she said, you know, while we have to be intentional and mindful about food, we also have to think about other things too. And she noted how there are clients of hers that she served that happened to be Black women, and that they were specifically looking for personal toiletries or personal hygiene products, and recognizing that a lot of the donations that Bright Paths was getting was not speaking to Black hair care. And so Chris, you know, made a mention that it's important for us to think about being intentional again and being mindful about all of the things that we're doing, not just food, but all of the things that we do, all of the programs that we do, really looking through that lens and making sure that the things that we have and the things that we do speak to the people that we serve. And so for me as a Black woman sitting there, I mean, that was like a revelation that I'd never heard of, you know, another organization making that acknowledgement and saying, yeah, we need hair care products that speak to Black women. We need these things that speak to, you know, these specific racial and ethnic groups. So I've never forgotten that. I've always appreciated that about Chris and about Bright Paths in terms of their level of intentionality and thinking differently about how you're serving your clients. As it relates to Food for Others, as Chris mentioned, you know, Food for Others has a client choice model. And again, thinking before Annie came on board, I remember having conversations with Roxanne before she retired about implementing this, client choice model. And so once I went to the site and saw it, it was just kind of like, wow, this is amazing. I mean, this really is a way to think more intentionally about, how do I serve my clients in ways that speak to them? How can I create that experience for them that's not stigmatizing, that isn't traumatizing, that they are coming in to this site and able to get food that speaks to them, and again, in a way that Shannon said, that's respectful and dignified. And so I just had a conversation with Leadership Fairfax at a presentation on food insecurity and equity. And one of the things that we were talking about is, how can we be more intentional with those donations? And one of the things, and Chris knows this because we've had this conversation so many times, is, call your local food provider organization first and ask the question, how can I serve? What is it that you need? As opposed to, making the assumption that what you're giving is actually going to have that impact that you're looking for. And yes, we always talk about well-intentioned or well-intended, but we know that intention and impact are two different things. And so we really need to start thinking differently about the types of impact that we want to have on the communities that we serve. And so I, along with my food provider organization, colleagues and partners and friends, say, please contact your food provider organization and just ask them what they need. Because what we don't want to do is create inequities for the people that we serve, but we certainly don't want to create inequities for those organizations as well, recognizing that many organizations have limited storage capacity and have limited infrastructure that can support a certain number of donations. So we want to be mindful and intentional about the ways that we serve, as well as who we are serving.
Thank you for that, Dawn. Wait for one more question we have time for, but I want to sort of put a bookend on, got the sun shining in my office now, on the workforce development, because I think the one, we as an organization at this juncture do so much good work. I think that I want to make sure we give ourselves credit for acknowledging really important trends. So the idea of Network Up, I think someone put into the chat, and the idea that with historically underserved populations, and if you're trying to move someone from one status to another in terms of socioeconomic status, the idea of having a sponsor or professionals to mentor you, if you've not had that in your life, or if you've grown up not having that kind of network and you miss that piece, we can pour dollars and time into skills building and skills transference and all these other compensatory sort of things. But if you don't have someone sponsoring your experience in a real sort of ongoing way, a lot of times those initiatives fall to the wayside because they're not infused with a sense of confidence and a sense of, I see you can do this. And so it's maybe a small thing that we gloss over now. We'll talk about it more in our second town hall, but really the idea of our promising our clients who come to us first for stability and then longer term resilience building is, you're not going to be alone. We see you and we're going to attach a person to your experience so that you get that ongoing sponsorship of an experience. And again, if you haven't had that in your life, you listen to clients or interviews I've had the privilege of doing, just the change in voice and the idea that someone is interested in where I go, it just means the world to folks. And so that's really a big part of the programming here and part of that equity lens that says, your situation needs this, let's go find a person who matches your needs. Big deal, it's a really big deal.
In order to make those steps, you have to have housing and food available, because our families are under so much stress. To ask them to concentrate on budgeting and workforce development is extremely difficult. So
wonderful. It's drawing close to the end of our time together. I feel like we're just getting started. But I really appreciate it. And again, this is the first of 3, and these conversations are going to grow in depth and breadth. So I encourage you to follow along. Before we turn it back to Lisa to bring us to a close, I do want to acknowledge any of our partner sponsors. And I see Annie, who wants to give us a couple of words. And is Greg on? Twins Ace? We'll give a shout out after. Annie, do you want to take 30 seconds to share with us?
I would love to. Thank you, Shannon, for inviting me. And I just want to say that your story about the water chestnuts, oh my goodness, that's powerful. And it gives me a good segue into what I wanted to share in a strange, unexpected way. So for those of you who don't know me, I'm Annie Moyer. I'm co-owner of Sun and Moon Yoga Studio, and we have 2 locations in Northern Virginia. One's in Arlington, and the other one is in Fairfax City. And we've been in various levels of partnership with Bright Paths for a long time, including our annual Thanksgiving, Thanks and Giving event at the studio, where we raise some awareness and get some food onto people's tables. So the story about the water chestnuts is to me, it evokes the process of mindful awareness. And in 2 weeks, I'm going to be sharing with your community, with the Bright Paths community, a Dharma talk and a conversation/meditation about mindful awareness as we look into an uncertain future from the standpoint of an uncertain present moment. And the water chestnut idea here that I'm getting to is that getting present, so having present moment awareness means that we turn our attention away from external distractions, all of the sensory stimuli that bombards us on a regular moment by moment level. So we turn our attention away from that, back inward, to clear away not just the stimulus and the knee-jerk responses that we have to those stimuli, but also from the conditioning that stimuli lays down in us. And with that conditioning comes bias. It brings assumptions. And one of those larger umbrella assumptions is that we don't really have to think too much, and that as much as we can do on autopilot, we do. So we can just keep doing. So we turn away from the distraction. We get clear in the present moment, start to let the distractions fade, start to let the conditioning recede. And then we can really pay attention so that when we go back out into the world to be of service and someone is hungry, we pay attention to who that person is. And we don't give them water chestnuts if that doesn't seem like the right thing relative to the person. So it's about refining that attention as we move forward.
Thank you, Annie. And I will be the first to sign up in 2 weeks. And stay tuned, all participants. We'll follow up with this meeting with a thank you and some links, which hopefully will include an invitation to that talk. So thank you for giving us a sample of that. I want to make real quick mention of Twins Ace Hardware. Is it June or July, Lisa, that we're doing the roundup?
It should be July.
July, that's what I thought. I wanted to make sure. So if you all are Fairfax adjacent or in the city proper, Twins Ace Hardware, which I patronized for the first time last week and we'll be going back a lot. I love it. They'll be doing a roundup for that entire month on behalf of Bright Paths. So customers who at checkout will have an opportunity to round up their purchase and those proceeds will come to us. So they were agreed to be on call, got distracted, but I promised I'd make a mention of that. So visit if you can. And with that, I will turn it back to Lisa and put up the slides so you can talk to us through that.
All right, great. Thank you. So I just wanted to give a shout out to Katie, who is representing Apple Federal Credit Union is one of our sponsors for Brighter Possibilities campaign, and we just really appreciated her being on here. She had to pop up for another meeting, but I just wanted to say that. And so I feel like we've just, as Shannon was saying, just sort of touched on it today. And, you know, in talking with our peer nonprofits who are also on this journey, the common thread is that there's no one size fits all solution, but we have to be intentional about it. And we have to have courage to face the difficult conversations. And over the course of the last 9 months, I've read or listened to some really great books that I would highly recommend if you wanted to be on that journey with us. There's White Fragility by Robin DiAngelo, How to Be an Anti-Racist, which is what I referenced before that our entire staff has read, by Ibram Kendi, Caste by Isabel Wilkerson, The Warmth of Other Suns, also by Isabel Wilkerson, and then most recently, The Sum of Us by Heather McGhee. So I do hope that you will join us for the next town hall on May 20th at 4:30. And it will be focusing on our resilience programs. So that will be workforce development and financial literacy, and looking at those programs and how we've modified them, looking through that equity lens. So please reach out to me if you have any questions or comments that you weren't able to address today. Dawn Hyman, thank you so much for being with us today. We really appreciated having you with us. The resilience town hall that we will be hosting is going to include a speaker from the Foundation for Financial Planning, John Dauphine, and that should be really engaging as well. So I'm going to put my email in the chat for you to easily contact me. And thank you again for joining us.
Thank you, Lisa, for everything, all your support. Thank you all. The last slide that you saw up was a question about giving us your feedback. And so in the chat, in just a few seconds, there will be a quick link. I think the survey may take 33 seconds. Prove me wrong and go faster, but it'd be great if everyone hung around and clicked on that in the chat feature and answer those few questions for us. We really want to make sure that we're presenting material in a way that's consumable and engaging, and so we invite your feedback. If you happen to have not time now, we'll go ahead and send that link out tomorrow as well, but do hope you take a few minutes now. Any other questions or comments before we say goodbye? All right, well, I'll try to play some music in the background because that soundtrack is really spent time on it. But again, we appreciate you. Thank you to our sponsors. Thank you to staff and board. Thank you to all the supporters. We hope to see you again on May 20th for our second conversation.
Thank you all.
Cheers all.
Bye all.
Bye. All right. I think that we can probably stop the recording.
Doing it.